Good morning, everyone. Hope you all are doing well and good. And that we have completed the gross anatomy of head and neck. We're going to start the neuroanatomy. Before that, we should have a good knowledge of development. If you know how the nervous system develops and from which it develops into the different parts of the nervous system, and how the cranial nerve nuclei and why it is situated in different sections of the brain stem, you will have a good understanding of neuroanatomy. So you just concentrate on the study, concentrate on the class now and understand the different nuclei which I am going to mention and its location. So the competency covered here is 43.4. As it is said by Marion C. Diamond, the human brain is the most complex mass of protoplasm on the earth. Hope you all agree for this, right? Nervous system, you know that we broadly classified into central nervous system and peripheral nervous system. Central nervous system includes brain and spinal cord, and peripheral nervous system includes peripheral nerves and the ganglia. So the study of development of nervous system, it's very important, which helps in understanding its complex organization and the occurrence of various congenital anomalies. We all have studied about this neural tube, notochord, right? Just recapitulate your memory of this development of neural tube and notochord, which we have studied in the general embryology, that the surface ectoderm in the center, it divides, it proliferates and then forms the neuroectoderm. I'll choose a pointer option. Okay. See, this is the notochord. Can you see my pointer? Can any one of you unmute and then say yes or no?
Yes, ma'am.
Yeah, good. Okay. So this is the notochord, right? Okay. Upon this, we have the neural tube. Notochord acts as a primary organizer or primary inducer that induces the development of neural tube. We know that the neuroectoderm, the central part above this notochord, the part of the surface ectoderm thickens and forms the medullary plate. Then it differentiates into neural tube, neural crest cells and the ectodermal placodes. We'll see now how the neural tube is formed and what are the structures which we are going to get from all these three derivatives of the neuroectoderm. Okay. The process of formation of neural tube is called as neurulation. Just to recapitulate, you just recollect that in pre-somoid period, that is between around 16th to 19th day, the surface ectoderm thickens and forms the neural plate. Okay. For this, the notochord acts as the primary inducer, which induces the formation of neural tube. See here in this image you can see this is this ectoderm, surface ectoderm, and green color thing is the mesoderm and below is the endoderm. In the center you have the notochord. On either side it forms a somoid, right? So the part of the surface ectoderm which lies above the notochord thickens and forms a neural plate. Neural plate is also called as medullary plate. As the development progresses, it shows a grooving that is called as neural groove and the elevation on either side is called as neural fold. As the development progresses, this neural groove deepens and forms the neural fold like this, right? Tube. And the tip of the neural fold is lined by pluripotent cells. These are called as neural crest cells. Okay. So later this neural crest cells gets differentiated and gets separated from the surface ectoderm as well as the neural tube and lies dorsolateral to the neural tube. So this fusion of like cells with the of one side with the like cells of the other side begins in the center. See in this. The fusion of the neural tube begins in the center and that extends craniocaudally. Okay, so the cranial neuropore is called as the cranial neuropore and the caudal opening is called as caudal neuropore. Around 25th day or at around 20th somoid stage, the cranial neuropore closes and the caudal neuropore closes at around 27th day or 25th somoid stage. So this is the process of formation of neural tube and the neural crest cells gets separated from the surface ectoderm as well as the neural tube. So what happens to this cranial and the caudal neural pore in the later part of life? So in the later part of life, in adults, the location of the cranial neuropore is represented by lamina terminalis. Please note down this point. Cranial neuropore in adults is represented by lamina terminalis and the caudal or the posterior. This is cranial is also called as anterior and the caudal is also called as posterior neuropore. It is represented by terminal ventricle which lies at the caudal end of spinal cord. Okay. Now you got to know that how the neural tube is formed, right? Can anyone of you summarize till now? How that the process of neurulation, if the question comes as a neurulation, you just have to mention about all this. So any development you take, it is not a complete one or ideal one. Any factor, environmental factor or a teratogenic factor which affects or genetic factors play a major role in the development. If any alteration in these, it leads to the congenital anomalies. Likewise, we also get many congenital anomalies during the development of the neural tube. Okay, so the neural tube defects can be detected now at early as 11th week of intrauterine development. I'll come to that point later. So now we know that the neural tube is formed, right? So how, from where the neural tube is formed? It is from the neuroectoderm, right? From where did we get the neuroectoderm? It is a part of surface ectoderm only, which lies above the notochord. So the cranial part of the neural tube, it shows dilatation like this. These are called as vesicles. Okay, it presents 3 vesicles. Cranial vesicle is called as these are the brain vesicles which forms prosencephalon, the cranial most. It is nothing but the forebrain. Middle one is called mesencephalon or the midbrain, and the lower part is called as rhombencephalon or the hindbrain. Later, this prosencephalon again gets differentiated into 2 parts. The yellow colored structure is represented by the derivatives of the prosencephalon. So prosencephalon gets differentiated into telencephalon, which later forms the cerebral hemisphere. Okay, then the caudal part of prosencephalon forms the diencephalon, which gives rise to all these structures. Note down: thalamus, metathalamus, hypothalamus, subthalamus, and epithalamus. All these structures which I am mentioning now, you will be seeing grossly in the brain as such. You will be knowing the location of the thalamus, you will be seeing what are the nuclei of the thalamus and the position of the hypothalamus and how the thalamus gets differentiated from or separated from the hypothalamus, and you will be seeing all these different parts of the diencephalon lying caudal to the cerebral hemisphere. Now you know why the location of the diencephalon is below the cerebral hemisphere, because it develops from the caudal part of the neural tube which lies below the telencephalon. Midbrain or the mesencephalon gives rise to midbrain, and the rhombencephalon again gets differentiated into cranial metencephalon that forms the cerebellum and pons. Caudal myencephalon that forms the medulla oblongata. Okay. So when the cerebral hemisphere or the telencephalon grows anteriorly, laterally and posteriorly in a limited space, it has to fold on itself and forms the curves, fissures and sulci. So if you come to the, as I'm telling, as the brain is growing, it has to accommodate within the limited space. That limited space is the cranial cavity. It cannot expand like your abdomen. Okay. So it is a skull. It is limited on all around by skull. It cannot expand. So it folds on itself. Earlier we know that it was a linear groove or elongated structure, neural tube. As it is growing like this, within the limited space, it has to accommodate on itself. So it folds on itself and presents flexures. It mainly presents 4 flexures. The first flexure is the Pontine Flexure. Pontine Flexure lies at the middle of rhombencephalon at the junction of myelencephalon and the metencephalon. It just lies at the middle of it. Okay, it presents ventral convexity. Then you get the dorsal convex flexure, that is called a cervical flexure, that lies at the junction of rhombencephalon and the spinal cord. Can you see the color differentiation here? So from this line to this line, it is rhombencephalon. This green color structure is the mesencephalon, and here it is the yellow and purplish. They are the parts of prosencephalon. So here the cervical flexure, which is the dorsal convex flexure, lies at the junction of rhombencephalon and the spinal cord. Then one more dorsal flexure you get at the middle of mesencephalon in the region of midbrain, and telencephalic flexure at the junction of telencephalon and diencephalon. So all these flexures appear due to overgrowth of the brain, right? Overgrowth of the brain within the limited space. It has to accommodate all the overgrowing parts, so it presents flexures. It is just like having a pleats of the sari. So it has to accommodate within the limited space, so we pleat it. So in the same way, the brain also pleats on itself, that we call it as flexures. So that is about the flexures, and I said it is a tube. Neural tube is a tube, right? It has a cavity inside. We came to know that the lining of it forms the wall, and what happens to the cavity as such now? So the cavity of the neural tube remains as ventricles. Okay. So on either side, you just keep this structure in mind. Okay. So this is the secondary brain vesicles, which are formed from the 3 primary brain vesicles. Keep this thing in mind, and now look at this. So you have on either side the 2 cavities. So cavities which are enclosed within the prosencephalon, right? So here the cavity of the telencephalon as such develops into lateral ventricle. Lateral ventricle communicates with the cavity of the diencephalon through the interventricular foramen of Monro. Can you see the arrow here? That represents the interventricular foramen of Monro that connects the cavity of telencephalon with the cavity of diencephalon. Cavity of telencephalon is lateral ventricle. Then the cavity of diencephalon forms the third ventricle. Cavity of mesencephalon is the cerebral aqueduct, and cavity of rhombencephalon is fourth ventricle. So prosencephalon has 2 parts, that is telencephalon and diencephalon. The cavity of the telencephalon is a lateral ventricle, cavity of diencephalon is third ventricle. So the lateral ventricle is connected to the third ventricle through the interventricular foramen of Monro. If you carefully listen to the class today, the neuroanatomy, it's very easy for you. If you don't listen here, if you don't understand anything here, neuroanatomy will be like again Greek and Latin, okay, that goes above your cranium. So concentrate and understand here the main structure and its development here, so that it will be easy to understand the functional aspect and location and gross structure of neuroanatomy, right? So then this cavity of the diencephalon, that is a third ventricle, is connected to the cavity of the mesencephalon, that is cerebral aqueduct, and through the cerebral aqueduct it is connected to the cavity of rhombencephalon, that is the spinal, the fourth ventricle. Cavity of the spinal cord forms the central canal of the spinal cord. Okay, in addition to all these ventricles, we won't be calling these as a cavity of the neural tube. Henceforth, we'll be calling them as ventricles. Okay. So these ventricles helps in circulation of the amniotic fluid. It gives passage to the amniotic fluid till the closure of anterior and posterior neuropore. Okay, and that helps in the development of or the growth of brain and spinal cord. Right. So from this roof of the fourth ventricle, you also have a communication. Two lateral foramina called foramina of Lashka and one central foramen is called foramen of Magendie that communicates with the subarachnoid space. All these communications are in such a way that it helps in passage of the amniotic fluid and also your CSF in adults so that it nourishes the brain and spinal cord throughout. Okay, in addition to all these ventricles, you can note down this point. The fifth ventricle is also present, that is called as Ampulla Caudalis. It is a viva question. The name of the fifth ventricle is Ampulla Caudalis. Where do we get the terminal ventricle? That lies in conus medullaris. So coming to the neural crest cells, though I have dealt this in the previous class, I'll just brief it here. So the cells, pluripotent cells which lines the tip of the neural tube gets differentiated and separated from the surface ectoderm and lie dorsolateral to the neural tube forms a neural crest cells. This neural crest is divided into ventral mass and the dorsal mass. So the dorsal mass again has three types of cells: neuroblast cells, then you have the spongioblast cells, and also you have pluripotent cells. Neuroblast cells gives rise to the dorsal root ganglion, sensory ganglion of 5th, 7th, 9th and 10th cranial nerves, and skeletal elements of pharyngeal arches, parafollicular cells of thyroid gland, odontoblast of teeth. Then your spongioblast gives rise to satellite cells. They are all supporting cells. Spongioblast means they are the glial cells, supporting cells. The pluripotent cell forms the melanocyte. These are all the derivatives from dorsal mass. Ventral mass mainly forms the chromaffin cells, sympathoblast, paraiotic body, enterochromaffin cells. So that is about the development of neural tube, its cavity, flexures, and the neural crest cells. We'll see how the spinal cord is formed. The part of the neural tube caudal to the hindbrain forms the spinal cord. Okay, so the development occurs in 4 different phases. If you look at this neural tube here, this is the structure of the neural tube. You are seeing a cavity inside, and immediately next to the cavity it is lined by single layer of cells, right? So this single layer of or simple epithelium proliferates and forms a pseudostratified epithelium, and all those cells migrate into the next layer, and the process of this migrate to the other layer, and the wall of the neural tube as such gets differentiated into 3 layers now. So the innermost being the ependymal layer. So we know that the ventricles are lined by ependymal cells. The next layer is called as mantle zone, where you get the neurons and neuroglial cells, and the outermost yellow color structure that represents the marginal layer and which forms the supporting neuroglial cells, and the process of which extend upwards and downwards and gives that forms a white matter of the spinal cord. So here it is same as it is here to the third picture. You can see here the central canal becomes compressed and lies in the center. The mantle zone, which is next to the ependymal layer, forms the gray matter, because in the gray matter you get the cell bodies of the neurons. Here what you get? Neurons or neuroblast and the spongioblast cells. Next to that, it is all the cell bodies are here, but processes runs in the next layer, that is in the marginal layer. So all these processes are myelinated, and that gives the appearance of whitish. So in spinal cord, gray matter is inside and the white matter is outside. You know now in spinal cord gray matter is inside and white matter is outside. Wherever you get the gray matter, you get the cell bodies of the neurons. White matter means it is all the axonal processes which forms a bundle or a tract which are lined by myelin sheath that gives the appearance of whitish. Next, as it is growing, that you are seeing one groove here, right? That is called as sulcus limitans. Sulcus limitans. That sulcus limitans separates the basal lamina from the alar lamina. The ventral part is called as basal lamina, which has all the motor neurons, and the alar lamina has the sensory neurons and it is dorsal in position. Okay, so that forms the dorsal horn. Remember now, if you can recollect the typical spinal nerve which we have studied in the thorax, we say the ventral nerve rootlets arises from the ventral horn, right? Right? And the dorsal nerve rootlets arises from the dorsal horn. One of you unmute and answer. Impana, are you there? Impana, are you there? You people just log in and go off, is it? Any one of you?
Yes,
Can
ma'am.
anyone of you answer my question? Say yes or no. At least one voice out of 250.
Yes, ma'am.
Who is that?
Ma'am, dorsal root carries sensory nerve fibers and ventral root carries
Who
motor
is
nerve
that? Who is that
fibers.
answering?
Ananya.
Ananya. Yes, tell me.
What, ma'am?
So the dorsal, can you just tell me about the typical spinal nerve, how the nerve rootlets arises and how it joins?
It's the first we have dorsal root and the ventral root. First, then after taking ferritin, both of them join to form a mixed trunk. Then we have the
Mixed
ventral root,
trunk.
which is
You mean till it forms a mixed trunk, they were separate. So I want you to tell what kind of nerve rootlets did you get from the dorsal root, dorsal horn as such, and what kinds of nerve rootlets you got it from the ventral horn.
dorsal root is the sensory fibers,
Very good.
and
Ventral
ventral
is
root is motor.
motor. Yeah, I wanted that answer from you. Okay, good. So here, as she said, the ventral horn is purely motor. That's why you are seeing the color difference here. It is blue and purplish here. That demarcation happens is because of the sulcus limitans. Sulcus limitans, I told you in the marginal, the mantle layer, you have the cell bodies of all the neurons and all the neurons are not same kind of neurons. You get two different kinds of neurons there, right? Motor neurons and the sensory neurons, but they cannot mix up. Okay, so they get differentiated themselves, and all those motor neurons occupy this position, means caudal to sulcus limitans and cranial to the sulcus limitans you get the accumulated sensory nerve rootlets. So as they are evolving, all these ventral nerve rootlets or the ventral neuron or the motor neurons or the efferent neurons occupy the caudal part of sulcus limitans, and that forms the basal lamina. What do you call this as? Basal lamina. All the sensory neurons, also called as afferent neurons, occupy the position cranial to the sulcus limitans, and that forms the alar lamina. Remember this point well. Alar lamina is dorsally located and the basal lamina is ventrally located. Ventral or the basal lamina has motor neurons, alar lamina has sensory neurons. Okay. So this basal lamina forms the ventral horn and alar lamina forms the anterior horn or the dorsal horn. Okay. So in the phase, this continued growth also forms this alar lamina grows and forms the posterior median septum, and this basal lamina forms the ventral median or the ventral median fissure. In the third stage, the histogenesis of the neural tube happens, where the cells in the mantle layer gets differentiated into neuroblast and the spongioblast. Neuroblast forms the neurons. So this is the place. Okay, this is a sulcus limitans, and here you have the middle layer that is called as mantle layer. So I told you in the mantle layer you get two types of cells, neuroblast and spongioblast. See, all these things, why I am telling is, why you have to know is, as you study the spinal cord, I think in physiology they have already taught you about the descending tracts and ascending tracts. Now you know that physiology, you should know that why the neurons are ascending from the spinal cord and why they occupy in the, why they are called as tracts and where they are situated, why we get the third cranial nerve nucleus in midbrain only, why it is not extended to it, and what is the function of it, why it reaches and it supplies only the muscles of the eyeball. All those things you will better understand when you know this development. So this mantle layer has two types of cells, spongioblast and neuroblast. Neuroblast forms the neurons and spongioblast forms the glial cells. They are the astrocytes and oligodendrocytes. See, neuroblast will be immature neuroblast in the initial position, that is like apolar neuroblast like this. As the development progresses, it presents two processes on either side. So, when you have two processes on either side, it is called as bipolar neurons. In the later part of the development, this one process is absorbed, only it remains as remaining single process, that is called as unipolar neuroblast, that elongates and forms the axon. Okay. So, this unipolar neuroblast later forms the multipolar neuroblast, and that forms the mature neurons. Once it is mature, multipolar neuroblast is formed, it loses its mitotic activity, means it will not multiply anymore. Okay. So, that lies here in the mantle layer. Cell bodies will lie here, and all this axonal process which are covered by myelin sheath extends on to the marginal layer. One thing you should remember here, motor neurons are differentiated earlier than sensory neurons. That means the neurons which are situated in the basal lamina get differentiated earlier than the sensory neurons which lie in the alar lamina. The next stage is here the formation of gray and white columns, right? Neurons of basal lamina forms the anterior horn. The nerve cells of the alar lamina forms the posterior horn. Okay, many neurons also forms the interneurons. Axons of the neurons forms the various part of the brain that enter into the marginal layer. So, the myelination of the nerve fiber gives this marginal layer whitish in appearance, whitish color. So, thus the mantle layer derived from the neuroblast forms the gray matter, whereas the marginal layer derived forms the white matter of the spinal cord. Okay. So, few cells which lie here, few cells which are at the from the basal and alar lamina proliferate and forms the lateral horn of the spinal cord. This you see in the thoracic segment of the spinal cord. So, the supporting cells forms two types of cells, the oligodendrocytes and the astrocyte. Astrocytes are of two types again, protoplasmic astrocyte and fibrous astrocyte. You get third type of supporting cell called microglial cells, they are mesenchymal origin. So, as we discuss the different sections of the nervous system in histology also, we will ask this. Tell me about the development of oligodendrocyte and the astrocyte. You should say oligodendrocyte and the astrocytes are derived from the spongioblast, or the supporting cells of the mantle zone, whereas the microglial cells from the mesenchymal tissue. I said the myelination gives, so this Schwann cells, right? Schwann cells forms the myelination of the nerve fibers in the central nervous system, whereas the oligodendrocyte forms the myelination of the nerves in the peripheral nervous system. So the myelination, it accounts for the growth and maturation of the neurons, and they get as they get mature, the myelination also increases. So then the next state is that the positional differences. During 3rd month or 8th week of intrauterine life, the spinal cord extends throughout the vertebral column. So you might have seen here, the spinal nerves emerge out of the corresponding intervertebral foramen. Due to differential growth of the vertebral column, as the vertebral column elongates faster than the spinal cord, the terminal end of the spinal cord shifts to a higher level. So at birth, you can see the lower end of the spinal cord ends at L3, and all the spinal nerves emerge obliquely downwards. In adults, the lower end of the spinal cord lies at L1, and the cauda equina, that is the lower end of the spinal cord with all the obliquely running nerve fibers, gives a appearance of a tail of a horse. So it is called as cauda equina. It is the derivative of neural tube. Because of this recession of the spinal cord, because of the differential growth of the vertebral column, the spinal nerves do not arise at a level corresponding to the intervertebral column. They run obliquely downwards. Okay, the spinal cord in adults ends at the level of L1, whereas the dura mater ends at the level of S1 or S2. Here you should note one point. The pia mater is derived from the neural crust cells, whereas the arachnoid and dura mater is from the condensation of the mesenchymal tissue around the neural tube. This is very important point, just note it down. Meninges, which covers the brain and the spinal cord, has 3 layers. Outermost dura mater, middle arachnoid mater, and inner pia mater. Outermost, the dura mater and the middle arachnoid mater are developed from the condensation of mesenchymal cells around the neural tube, whereas the pia mater is from the neural crust cells. Okay. So in nutshell, the development of spinal cord is that formation. First, there is a formation of the mantle and the marginal layer because of the proliferation of the neuroepithelial cells. These neuroepithelial cells are the single layer of cells which lines the cavity of the neural tube, ependymal cells. The cells, it was a single layer cells in the beginning. Later, it proliferates and forms a pseudo-stratified epithelium. Later, the cells migrate into the mantle layer, later into the marginal layer. And it gets differentiated into basal and alar lamina depending on their function. Motor neurons lie in the basal lamina and sensory neurons in the alar lamina. Sulcus limitance differentiates these two laminas. Okay, then the neuroepithelial cells in the mantle layer differentiates into 2 types, neuroblasts and spongioblasts. And because of all these differential growth, the vertebral column grows faster than the spinal cord. The length of the spinal cord corresponds to the level of this vertebral canal in case of around 3rd month of intrauterine life, whereas in adults it lies at a higher level. So that is about the development of spinal cord. As I told you, the neural tube defects, we commonly call it as NT defects. They are very common. It is due to the non-closure of the neural tube. It is the commonest birth defect. Okay. and it occurs mainly, the important main factor for this is the folic acid deficiency. Why folic acid is necessary? I think the biochemistry people have already finished their portion. Tell me why folic acid is necessary? It is necessary for the synthesis of DNA and RNA, right?
Urea and pyramid.
Yes. Okay. So because of the defect, because of the deficiency of the folic acid, this neural tube development also will not occur properly. That results to many neural tube defects. This can be prevented by supplementing the mother with the folic acid. Usually we give 0.4 milligram per day of the folic acid supplementation is given prior to the conception up to about 3 months or 12 weeks of pregnancy. And it can also be detected by doing alpha fetoprotein level at as early as the 11th week of intrauterine life, and also by ultrasonography or USG. So folic acid supplementation plays a major role in preventing many of the neural tube defects. So the neural tube defect is mainly the spina bifida defect. It occurs in first 4 weeks of pregnancy. Okay, it is also because of one factor I said, it is folic acid deficiency. The other may be because of the gene defect, that is MTHFR gene defect. Okay, that leads to MTHFR gene leads to incomplete closure of neural tube and incomplete formation of the vertebra. In turn, that leads to bifid spine, right? When the neural tube doesn't close it properly, I told you that the neural tube closes in the middle, later it extends craniocaudally, right? If it doesn't close anywhere along this, that leads to spina bifida. So the important ones are spina bifida occulta. It is due to the defective formation of lamina of the vertebra. Then we have spina bifida with meningocele. It is only the protrusion of the meninges through the lamina defect. Whereas in case of spina bifida meningomyelocele, along with the meninges, this part of the spinal cord also protrudes through this defect. Then rhexasis, it is the defective closure of neural tube and lamina of the vertebra. You can see in this image how the defects are formed. This is spina bifida occulta, where you can see only the dimple in the region of the defect. Okay, and also you get tough hairs. It usually occurs at the junction of lumbosacral region, where the defect is marked on the surface by the dimple along with tough hair. Whereas in the meningocele, you can see a bulging on the surface of the baby on the dorsal aspect on the back, where the bulging is very soft, covered by skin and also with the meninges. Whereas this is the meningomyelocele, is a severe form of neural tube defects where the spinal cord also protrudes through it. Okay, the main treatment for these two conditions, this doesn't require treatment. Usually these two are requires surgery. So you can see here, this is how the normal curvature is in case of normal babies, whereas in the spinal defects, meningocele and meningomyelocele, you can see the bulging on the surface. Okay, so that is about the defects of the spinal cord. So now we have learned how the neural tube is formed, derivatives of the neural crest, defects of the neural tube, and how the spinal cord is formed, and why you get the gray matter inside and white matter outside in the spinal cord, right? And why the motor neurons or the motor nerve rootlets emerges out of ventral horn only, and why the sensory neurons or the afferent neurons emerge out of the anterior horn, the dorsal horn only. Okay, and what differentiate these two, that is sulcus limitans differentiate the basal lamina from alar lamina. As you ascend up from the spinal cord, you know the extent of the spinal cord now. As you move up towards the cerebral hemisphere, you come across a small segment that is called as brain stem. Okay, brain stem. Brain stem has three different parts, that is midbrain, pons and medulla oblongata. Together constitutes the brain stem. What are the three structures? Midbrain, pons and medulla oblongata. Together it is called as brainstem. Unless we say it is the midbrain or specifically the pons, brainstem means anywhere along this. Okay. So these three things together, these three parts of the brain together, it is called as brainstem. And you get many cranial nerve nuclei situated or extending throughout this, and this is where you have to concentrate. Okay, concentrate on this so that it will not be because in the exam in the neuroanatomy as such we ask the cross sections. Write the cross section, draw a neat label diagram of cross section of the midbrain at the level of superior colliculus, and draw the cross section of the pons at the level of the facial nerve nuclei. Draw the cross section of the medulla oblongata where the fibers cross over, or at the level of inferior alveolar nucleus. So to remember what are the nuclei, what are the structures you get at that level, you cannot just mug up the names of those nuclei. Okay. Should have a better understanding of all this position of the cranial nerve nuclei, then only it will be easy for you. So now you know that midbrain, pons and medulla oblongata together it is called as brainstem. And here also sulcus limitans. See, this is the sulcus limitans that divides the brainstem into alar lamina and basal lamina. Okay. Cells of the basal lamina are efferent in nature. Efferent means what? They are motor. And cells of the alar lamina are afferent in nature. That means they are sensory in nature. Group of neurons in these columns perform specific function via the cranial nerves. So, the cranial nerve nuclei, they form the cranial nerve nuclei. So, as they are growing, the hindbrain flattens. This is the rhombic clip. It flattens, and so this was in case of spinal cord, it was vertically situated. Just above this, it was like this, right? They were vertically situated. Because of the flattening of the rhombic lip, the alar lamina comes and lies on the lateral aspect of basal lamina. Okay. So in this, you see, in the brain stem, you get 7 functional columns. 3 are motor in nature, they lie in the basal lamina, and 4 are sensory in nature, that lie in the alar lamina. So these 3 columns are, they are general somatic efferent, special visceral efferent, general visceral efferent. Then in the alar lamina you have general visceral afferent, special visceral afferent, general somatic afferent and special somatic afferent. I'll tell you why you should remember all these names and what do they do, what is their function. Remember here in this, at this point you just remember basal lamina has 3 functional columns and all these are motor in nature. And in alar lamina in the brainstem you have 4 functional columns and all these are sensory in nature. And here you have the sulcus limitans. The sulcus limitans, near to the sulcus limitans you get visceral component. Got it? See here, visceral components are nearer to the sulcus limitans and the somatic components are away from the sulcus limitans. That is the first point. The second point is in the visceral component, general visceral components are nearer to the sulcus limitans than the special visceral component. Okay. So, 3 things you must remember here. In the brain stem, there are 7 functional columns, right? Note down this. There are 7 functional columns in the brain stem. 3 in the basal lamina which are motor or efferent. 4 in the alar lamina which are sensory or afferent. Okay. Then visceral components are nearer to sulcus limitans. In that specifically general visceral components are nearer to the sulcus limitans than the somatic components. Okay. in this. What is the function of all these columns and why they have segregated? That is your next question, right? So here, this is the midline, and as I said, this is the roof plate of the rhombic lip that is widened, and here you have the sulcus limitans. That is the one which is differentiating the basal lamina from the alar lamina. So we'll begin from here. So the first medial most here is general somatic efferent. We call it as GSE. Okay, GSE is the general somatic efferent that lies in the basal lamina towards the midline. It supplies what? See here, it supplies the striated muscle of the head not originated from the pharyngeal arches. What is the function of the nerve fibers which arises from the general somatic efferent column? The nerves supplies the striated skeletal, or striated is nothing but the skeletal muscles of the head that are not originated from the pharyngeal arches. Then what is the function of the nerve fibers which arises from the special visceral efferent column? That supplies the striated muscles of the head which are derived from the pharyngeal arches. Means this nerve supplies the muscles which are not derived from the pharyngeal arches. Then we are left with the muscles which are derived from the pharyngeal arches. That will be taken over by special visceral efferent column. Okay. Next to that we have general visceral efferent. So this general visceral efferent supplies the preganglionic parasympathetic fibers to the smooth muscles. Then you have general visceral afferent. It carries the sensation from the viscera. Afferent means sensory fibers. So the general visceral afferent carries the sensation from the visceras through the vagus nerve. Special visceral afferent, it is not the general, so it is special, that it carries the taste sensation from the tongue. General somatic carries the proprioceptive and the tactile fibers from the face or the oral, nasal and the pharyngeal arches. Then lastly we are left with special somatic afferent, that is receives the impulses from auditory, that is hearing and equilibrium, auditory nerve and vestibulocochlear nerve. So these four columns are sensory. One receives from the visceras and the other from the taste, the other from the skin, the other for hearing. Whereas these supply the muscles of the not of pharyngeal origin, the muscles which are derived from the pharyngeal origin, the other from the smooth muscles of the visceras. So that's why they have a different functional columns. Now after knowing that each has its own function, defined function, we have to learn where the nuclei are situated, from where they are arising. Okay, they should have their definite nuclei inside the brain, and which their nephrine nuclei is located in which part of the brain stem and how it is coming out. So we just learned the basal lamina first, right? This is a somatic efferent column. Somatic efferent column, I said, it supplies the general somatic efferent column. It supplies the striated muscle fibers, that is of the head, not of pharyngeal origin, right? Pharyngeal arch origin. They supply the muscles of the extraocular muscles. I'll just show you in this. This is the better image. Okay, so this is the general somatic efferent. General somatic efferent. It has to supply the striated muscles of the head, not of pharyngeal origin. It has these four nuclei: third cranial, fourth, sixth, and the 12th cranial nerve nuclei. Third and fourth are situated in the midbrain. Sixth cranial nerve nuclei in the pons. 12th cranial nerve nuclei in the medulla oblongata. Okay. So, general somatic efferent has to supply the muscles derived from the skeletal muscles of the head, which are not of pharyngeal origin, it supplies through the general somatic efferent column, and it has nuclei at these three parts of the brain stem, and these are the four cranial nerve nuclei. Okay, so third cranial nerve nuclei, it is situated in the midbrain that supplies the extraocular muscles of the eyeball. Okay, so now you recollect all the muscles of the eyeball are supplied by third cranial nerve, oculomotor nerve, except, can any one of you unmute and say, except which two
Superior
muscles?
oblique and lateral rectus.
Very good. SO4 and LR6, right? SO4 is superior oblique. Superior oblique is supplied by trochlear nerve, SO4. See here we have a separate cranial nerve nuclei for that to supply the superior oblique muscle. Okay, that comes again under general somatic efferent. Again one more muscle is LR6, lateral rectus 6. Lateral rectus is supplied by the sixth cranial nerve nuclei, that is the abducens, that lies at pons. Then you have the medulla oblongata. Medulla oblongata, that is, 1 second, I'll take attendance. Atapa? Okay. So, where was I? LR6, lateral rectus is supplied by the sixth cranial nerve nucleus that lies in the pons. So, what is the function of these three now? All the extraocular muscles of the eyeball are supplied by oculomotor, SO4 superior oblique, LR6 at the pons. Then we have in the medulla oblongata one more cranial nerve nuclei, that's the 12th cranial nerve nuclei, that supplies the muscles of the tongue, except palatoglossus. So under GSE, that is general somatic efferent, you will get these four cranial nerve nuclei, 3rd, 4th, 6th and 12th. So if I ask you to write or draw a neat label diagram of cross section of the midbrain at the level of superior colliculus, now you are sure that you should write the 3rd cranial nerve nuclei, oculomotor. And if I ask you at the level of lower part of the midbrain, that is at the level of inferior colliculus, you are sure that you should write 4th cranial nerve nuclei. Fine? Clear? Any doubt here in GSE? Say yes or no. Are you all hearing me? No response. Acknowledge.
Yes, ma'am.
Yes, ma'am. Clear.
Any doubt?
No, ma'am.
No.
No, ma'am.
If any doubts are there, you can ask me now only. Because it is a very important thing. Please ask question. Or shall I ask you back? Any one doubt from anyone? First table students? Any doubt? So neuroanatomy first class I'll come for the brain, spinal cord or the brain stem. I'll ask you all this. What are the cranial nerve nuclei you get in the midbrain under GSE? You should say it is 3rd and 4th. What is the function of GSE, that is general somatic efferent? It supplies the muscles. It supplies the striated muscles which are not of pharyngeal arch origin. You know that extraocular muscles, are they from pharyngeal arches? No, nowhere we studied. And about the tongue muscles? No, they are all migratory muscles from the occipital myotomes, right? So these muscles are supplied by this functional column, that is through the general somatic efferent. Under that you get 4 nuclei. third cranial nerve nuclei, fourth, sixth and 12th. But they are all not situated at one place. They are at different levels of this brainstem. So these three things together forms a brainstem. Clear now? I'm sitting in this empty classroom, but you people are alive, right? You can answer me.
Yes, ma'am.
Yes. Any
Yes,
doubt,
ma'am.
Sham?
No, ma'am.
No. Okay. So the next functional column in the basal lamina is special visceral efferent. What I told for this functional column, this purple color, it supplies the muscles which are derived from pharyngeal arches, right? So here you have motor nucleus of the trigeminal nerve. What nucleus is that? We have studied this. All the nerve fibers emerging out from the basal lamina are motor neurons only. So under this column, you don't have any nuclei in the midbrain. You get it in the pons, that is the motor nucleus of the trigeminal nerve. Then at the lower part of the pons, you have the motor nucleus of the facial nerve. What is the function of motor nucleus of the, first you tell me, what is the function of SVE? It has to supply all the muscles which are derived from the pharyngeal arch. So the motor nucleus of the trigeminal has to supply which arch? You tell me, one of you unmute and tell me. Which is the nerve of first arch?
Mandibular nerve.
Yeah, mandibular nerve is from the trigeminal nerve. So this motor nucleus of the trigeminal nerve, the nerve rootlets which are arising from the motor nucleus of the trigeminal supply the muscles of first arch. This is motor nucleus of the facial nerve supplies the muscles of second arch. Then the nerve nuclei of 9th, 10th and 11th together form a single nucleus that is called nucleus ambiguous. This supplies the 3rd, 4th and 6th arch respectively. When we are showing the section of the medulla oblongata, we show you, see, this is the nerve nuclei of nucleus ambiguous, or this is the nucleus ambiguous. Nucleus ambiguous means you should not think from where did this come, where was this. Nucleus ambiguous is the united part or the united nuclei of these three cranial nerves, 9th, 10th and 11th. So part of the nerve rootlets which are arising from the cranial part of it supplies the 3rd arch. From here it supplies the 4th arch. From here it supplies the 6th arch. Okay. So if we take a section at the level of inferior colliculus in the pons, what are the nerve nuclei you expect? 6 nerve nuclei, 7 nerve nucleus and superior salivary nucleus and mesencephalic nucleus of the trigeminal nerve and the vestibulocochlear nerve. So these are the nuclei you get in the lower section of the pons. That's how it is studied. So that is about SVE. The last component of the basal lamina is general visceral efferent. That means it carries the preganglionic autonomic fibers to the viscera. Okay. At midbrain, you have Edinger-Westphal nucleus. It supplies sphincter, pupillae and ciliary muscles. Okay. Then in the pons, you have the superior salivary nucleus and the lacrimatory nucleus. This superior salivary nucleus supplies submandibular and sublingual gland, and lacrimatory nucleus supplies the lacrimal nucleus. Now you can correlate. For submandibular gland, we have studied that it carries the preganglionic parasympathetic fibers from the superior salivary nucleus, right? This is how it is derived. Then at the lower part, we have the inferior salivary nucleus and also the dorsal nucleus of vagus nerve. Dorsal nucleus of vagus nerve supplies which gland? Parotid gland. Parotid gland. So these are the three things you get it in the basal lamina. Next thing is sulcus limitance, that divides the motor column from sensory column. So nearer to the midline, you have general visceral afferent and special visceral afferent. It carries the visceral sensation and the taste sensation. Visceral sensation is through the dorsal nucleus of the vagus nerve, that is the 10th cranial nerve, and the taste sensation is through the nucleus of tractus solitarius. I said nucleus ambiguous is formed from 9, 10 and 11. Nucleus tractus solitarius from 7, 9, 10. Remember this. You will be seeing the nucleus tractus solitarius in the section of medulla oblongata. That means 7th, 9th and 10th cranial nerve. What does it do? It carries the taste sensation. Okay. Next column is general somatic afferent. It has a representation throughout the brain stem. In the cranial part of the brain stem, you have the mesencephalic nucleus of the trigeminal nerve, and in the lower part it is a spinal nucleus of the trigeminal nerve. So the trigeminal nerve has two roots, you know that, sensory root and the motor root. Sensory root is divided into three divisions: ophthalmic, maxillary and mandibular. So these three have a larger area of representation in the brain stem. Okay, in the midbrain it has mesencephalic nucleus of the trigeminal nerve. In the pons it is a sensory nuclei, and in the medulla oblongata it is a spinal nucleus of trigeminal nerve. Where is the motor nucleus of the trigeminal nerve? See, it is here under SVE in the cranial part of pons. In the special somatic afferent, it supplies what? It carries the afferent fibers from vestibular and cochlear nerve nuclei. Okay. So this is how they are represented. It is a cross section of the medulla oblongata. This is spinal cord here. Here is a medulla oblongata, pons and midbrain. Okay. And this is how the nuclei are elongated and represented in the brainstem. So that is about the development of brainstem. If you come to the development of cerebellum, it is the Pontine Flexure, the alar plates move laterally and bend medially like this. It bends, and then stretching the thinner plate of roof, that forms a rhombic lip, and widening of this, it forms the fourth ventricle. There is a simple example to demonstrate this. You just take a tube, any pipe, and then slit it vertically on its one surface and bend it ventrally, so that you can see the formation of the fourth ventricle. And if you look at the development of cerebrum, as I have told you, telencephalon and diencephalon are the parts of prosencephalon. The cerebral cortex grows in various directions. Ventrally it forms a frontal lobe, dorsally occipital lobe, laterally parietal lobe. Okay, and continued growth of this forms the fissures. So initially the cerebral cortex is smooth, it has a smooth surface. So the lateral sulcus is the first one to develop, and as it is covered by the loose areolar tissue, mesenchymal tissue, which forms the meninges, the postnatally the volume of the newborn grows 4 times the adult, and in the beginning of the first year it enlarges enormously, so that at the end of first year it is 3/4 of an adult size. So it is the growth in the volume is by increasing in the size and not in the number of nerve fibers. Growth of the individual neurons. Okay, along with that, it proliferates of the proliferation of dendrites and axonal process, and is responsible for the most of the development of the brain. At first year, it weighs of about 1000 grams, and second year it weighs 80% of the adult size, and around 18 years it reaches the size of adult, that is 1400 to 1500 grams. Okay, coming to the congenital anomalies of the development of brain. Anencephaly is defective formation of skull cap. Meningocele is protrusion of meninges through the skull defect. Meningohydroencephalocele is protrusion of meninges and brain tissue with the dilated ventricle. Okay. See in this. Hydrocephalus is the commonest condition we see where there is a distension of the ventricles which filled with CSF. Microcephaly is small size brain and skull. Exencephaly is the brain is located outside the skull because of the defective development or fusion of occipital bones. Meningoencephalocele is where you have only the protrusion of the meninges and brain. Arnold-Chiari malformation is herniation of cerebrum and part of the cerebellum through the foramen magnum. So that is about the development of brain and spinal cord. The important and cutest and smallest structure of the brain is pituitary gland. Even though it is small, you cannot assess its function by its size. Okay, it is situated in the sella turcica. You know that this is the place where the mast of the endocrine gland is situated. That is the pituitary gland. It has two parts. Anterior lobe or the adenohypophysis and the posterior lobe or the neurohypophysis. Anterior lobe is developed from the upward growth of the roof of the stomodium. See, anterior lobe. It is the roof of stomodium from where it shows the upward growth that is called as Rathke's pouch, and the posterior lobe is or the neurohypophysis is the descending part of the diencephalon, both of which unite. See like this. This is the Rathke's pouch and this is the neuroectoderm that descends down, this ascends up. And the cavity of the Rathke's pouch, okay, it encloses and covers both of them, unite and forms the pituitary gland. Right. So acidophil cells, you know that it has acidophils and the basophil cells. Acidophil cells appear earlier than the basophil cells. And if the remnants of the Rathke's pouch are left, that leads to a tumor that is called craniopharyngioma, and cavity of usually the cavity of the Rathke's pouch remains as intraglandular cleft. And pituitary adenoma of the anterior lobe is also a commonest condition that leads to high cortisol level, high BP, high sugar and moon face. This is the typical feature of Cushing's disease. We know that many hormones are secreted like growth hormone, ACTH, TSH, they are all secreted from the pituitary gland. If there is any abnormality, it leads to gigantism, acromegaly and dwarfism. The other endocrine glands, you know that the endocrine glands are ductless glands. Their secretion is called hormones and it is directly poured into the bloodstream. Name few endocrine glands in the body: pituitary gland, the pineal gland, thyroid, parathyroid, adrenal, and the endocrine part of pancreas, testes, ovary, hypothalamus. Okay, these are all the endocrine glands. The last topic for today is adrenal gland. Adrenal gland is situated above the upper pole of the kidney. Okay, it weighs of about 5 gram and it has two parts: outer cortex and inner medulla. The cortex, see, this is the place where you get the developing gonad. So the cells of the dorsal wall of the coelomic epithelium proliferate and form a ridge called suprarenal ridge. Adrenal cortex, the cells of this develops in two episodes. The first cells proliferate, the first group of cells proliferate and move inward and surround the cells in the medulla. The second cells proliferate, acidophilic cells, they surround the adrenal medulla, and the second set of cells arise from the suprarenal ridge. They are basophilic and surround the fetal cortex. Okay. So you remember here, suprarenal gland is also called as adrenal gland, that is situated above the upper pole of the kidney. It has two parts, outer cortex and inner medulla. It is developed from the proliferation of the coelomic epithelium, which lies midway between the gonadal ridge and the dorsal mesentery. So it forms a suprarenal ridge. The proliferating cells, the first group of cells are acidophilic in nature that move inward and surround the medulla. The second group of cells which arises from the suprarenal ridge, they remain in the cortex and forms the cortical part. So medulla is this. So now you know that the cortex is ectodermal in origin, whereas the medulla is from the neural crest. By 45th day, the sympathochromaffin cells derived from the neural crest enter the fetal cortex from the medial side, and these cells differentiate to form the adrenal medulla. So the cortex has three layers: glomerulosa, fasciculata and reticularis. Glomerulosa secretes mineralocorticoids or the aldosterone, fasciculata secretes glucocorticoids or the cortisol, and reticularis secretes androgen. Medulla secretes what? Catecholamines, epinephrine and norepinephrine. So fetal suprarenal gland is 10 to 20 times larger than adult suprarenal gland, and at birth it forms the parenchyma. The size of the suprarenal gland is about 1/3 of the size of the kidney, whereas in case of adults it is 1/30th the size of kidney. So if you look at its development at birth, you will have only two zones in the cortex, that is zona glomerulosa and fasciculata. The reticularis develops only at the end of 3rd year of life. Remember, at birth, cortex of suprarenal gland has only two layers, glomerulosa and fasciculata. Reticularis arises at 3rd year of life. In addition to its normal location, suprarenal gland is also found around the main gland and around the gastrosplenic ligament, great omentum, and also in the broad ligament of uterus. So during its development, if the pheochromocytoma is the autosomal dominant disorder presenting with headache, sweating, palpitation, hypertension and anxiety, it is the commonest tumor of adrenal gland. They are always present with increased production of cortisol, which causes Cushing syndrome. This is the classical signs of Cushing syndrome: central obesity, moon face, okay, and also buffalo hump and thin arms and pendulous abdomen. Addison's disease due to inadequate production of cortisol. It's an autoimmune disease caused by body's immune system that destroys the adrenal gland. So that finishes the development of nervous system, pituitary gland, and the endocrine glands like pituitary and adrenal gland. Okay. So in this, to sum up, we studied that the neural plate is formed at the beginning of 3rd week, neural folds at 4th week, anterior neuropore closes at 25th day, posterior at 27th day, and the neural tube is fully closed at 4th week, and in 5th week brain vesicles have formed with flexures. Myelination begins in the 4th month, differentiation of cerebellum at 8th week, and cerebellar cortex appear around 12th week, and dentate nucleus is seen in 15th week. So that is about the development of nervous system. Any doubt? With this, we complete the general embryology as well as the systemic embryology. The whole embryology with all the other systems are completed. We'll try to have a revision class before your exam, or once you come back, we'll see. Any doubts, you can ask me. See, study this neuroanatomy very well, this development of nervous system very well to understand the neuroanatomy better. Until and unless you study this, it's very difficult to understand the neuroanatomy. You cannot mug up everything. Okay. Hope you have understood everything. No other doubts? Okay. Then we'll end the session. Thank you all.